Hello, I'm Dr. Suparna Banerjee. I'm an infertility specialist. I am the director of Ankur Fertility Clinic and Institute of Reproductive Solution, which is situated in Uttarpara, Hooghly district. Today, it's a very pertinent question from my patient, which I want to address here, is if somebody is suffering from endometriosis, can they become mother through IVF? For this to discuss, we need to understand the problem here. So endometriosis is a problem. You know, when a woman is bleeding every month from the uterus, but when for some reason this bleeding is happening inside other than uterus, inside her abdomen, on the ovary, in other parts, then that bleeding is pent up there because it has got no way of exit, and that become a collection. Usually, mostly it affects the ovaries of the woman, and it's a very painful condition. During period, it is sometimes causing extremely pain, and sometimes after the periods or before the periods also it causes pain. So it is causing problem at her day-to-day life. Of course, it is causing problem in her fertility. Why? Her ovary is getting damaged every month when she is bleeding, and that's why the number of eggs in the ovary also getting less and less in every month. And as it is becoming big cyst and painful condition, she might end up in operation where the chocolate cyst is removed. As a result, part of the ovary is removed. As a result, number of eggs becomes more diminished. So the fertility aspect of the problem is your fertility is getting diminished day by day, either due to the process itself or because you had operation and some part of your ovary is already removed, so number of egg is less. And also because it is a painful condition, and when a big cyst is sitting there, or it is because the pain is partly due to some adhesion formation inside the uterus, which causes adhesions of bladder, bowel, all these organs with uterus. So it becomes again painful when she's passing urine or opening bowel or having sex. So all the time it is like pain is all she's living with. So it is basically very painful condition that we all understand. But regarding pregnancy, can she become pregnant with IVF? The answer is yes. IVF is a solution for her. So depending on which stage of the disease she is in, we can go directly for IVF, or after the operation we go for IVF. So there are different stages of endometriosis. That is the milder stage we call is stage 1 or 2. Slightly advanced stage 3, and then where the cyst formation happens, and very advanced stage is stage 4. So she can be in any of the stage. So it is a diagnosis which is done by your doctor, and then depending on which stage you are in, if you are in a earlier stage 1, stage 2, you might not need any operation, or even if you need an operation, that is a diagnostic or very mild, very less invasive operation, and you might not need IVF at all. But on the other hand, if you are in advanced stage, that is stage 3, stage 4, you might need operation, you might not need operation, depending on your symptom and the size of the chocolate cyst which is affecting your ovary. And depending on that, and if you have any previous operation, then also nowadays we suggest do not go for second or third time operation, as it is a very this condition has got a high recurrence rate. So you have to be careful. If you have an operation, then you have to be in touch with your gynecologist, so that somebody should follow up your condition, that it should not go into that bad condition again, so that you will end up in another operation that is detrimental for your fertility. And of course, operation is a risky procedure anyway. So if you are in grade 3, grade 4 endometriosis, then we plan your pregnancy in a way. Yes, IVF is a solution for you, but when we need to get that right window of your fertility, so that if somebody has got operation, so it is after the operation, next few months is the best window when you plan for your pregnancy. Maybe it is IVF, or if you're already your ovary is very much damaged, then also there is solution. We give some medication to suppress your endometriosis first without going to the operation, and then directly put you through the IVF. So there is a solution for you in the IVF, especially when you are in stage 3, stage 4 endometriosis.